Hi and welcome back to Dr. O'Donovan Medicine Made Easy. In today's video, we're going to be covering key things that you need to know about a medication called Tamsulosin, which is also known by its brand names Flomax Relief and Flomaxtra XL. Tamsulosin is typically used to treat men with an enlarged prostate, and occasionally it's also used for kidney stones. But before we get into the main section of this video, please remember to subscribe to the channel if you haven't done so already. So let's start off the video with understanding a little bit about Tamsulosin, how it works and what it's used for. So Tamsulosin belongs to a group of medications called alpha blockers, and it's normally used to treat men with symptoms of an enlarged prostate, which is known medically as benign prostatic hypertrophy or BPH. Essentially, if you've got an enlarged prostate gland, it helps by relaxing the muscle around the bladder and prostate gland, making it easier to pass urine. In some cases, it can also be used to help ease the passing of kidney stones through the urinary tract. So now we know a little bit more about what Tamsulosin is, what kind of medicine it is, and what it's used for. Well, what forms is it available in and how do you take it? Well, in the UK, Tamsulosin is available on prescription, and you can also buy it from pharmacies. It comes as tablets and capsules. If you buy Tamsulosin from a pharmacy, make sure you see your doctor within 6 weeks of starting your treatment to make sure it's okay for you to carry on taking this medicine. Now, in practical terms, Tamsulosin is taken once a day, usually in the morning, after breakfast, or the first meal of the day. It comes as slow-release tablets and capsules, also called modified release, prolonged release, or in shorthand MR or XL. This means that the medicine is released into your body gradually. So how much Tamsulosin will you take? Well, this is going to vary depending on person to person and what your doctor may prescribe, but the usual dose of Tamsulosin for enlarged prostate and kidney stones is 400 micrograms once a day. In terms of how you take it, well, advice is that you should swallow your Tonsillosin capsules or tablets whole with a glass of water, and it's important not to break, crush or chew the tablets. If you can, take Tamsulosin in the morning, after breakfast or the first meal or snack of the day. This is so that the highest levels of medicine are in your body during the day, and it gives you the most benefit when you're most likely trying to go to the toilet to pass urine. And it's also best to try take it around the same time each day for consistency. When you first take Tamsulosin, it may make you feel dizzy or lightheaded. If this happens, it's best to sit or lie down until you feel better. If this side effect continues and is troublesome, then speak to your doctor or pharmacist about this. So who can and can't take Tamsulosin? Well, in most cases, Tamsulosin can be taken by adults aged 18 and over. It's important that this medicine is not taken by children unless on the advice of a specialist. Like some medicines, Tamsulosin is not suitable for some people. To make sure that the medicine is safe for you, you should tell your doctor if you've ever had an allergic reaction to Tamsulosin or any other similar medicine in the past. You should also let your doctor know if you have something called orthostatic hypotension. This is a form of low blood pressure that can make you feel dizzy or lightheaded when you stand up. The problem here is that Tamsulosin can exacerbate this effect and put you at risk of unnecessary falls. You should also let your doctor know if you've got severe liver or kidney problems, or you're having eye surgery for cataracts or glaucoma. So what should you do if you accidentally forget to take Tamsulosin? Well, if you miss a dose of Tamsulosin and you remember within 6 hours, take the missed dose as soon as you remember. If it's more than 6 hours, skip the missed dose and take your next dose at the usual time the next day. It's important not to take a double dose to make up for a forgotten dose, and if you forget doses often, it may help you to set an alarm on something like your phone to remind you. You could also ask your pharmacist for advice on other ways to help you remember to take your medication. Now, another question that is commonly asked is, what if I take too much Tamsulosin? Well, taking too much Tamsulosin can lead to a decrease in your blood pressure and increase in your heart rate. As a result, you may feel drowsy, faint and lightheaded. If you need to go to hospital, it's important that you don't drive yourself. Get someone else to drive you or call an ambulance. Take the Tamsulosin packet or the leaflet inside it with you, plus any remaining medicine. So now let's discuss some possible side effects. Well, like all medications, Tamsulosin can cause side effects, but many people have no side effects or only very minor ones, and side effects often improve as your body gets used to the medicine. First of all, we'll talk a little bit about common side effects, and these are side effects that happen in more than 1 in 100 people. They're usually mild and short-lived, but you should talk to your doctor or pharmacist if these side effects bother you or last than more than a few days. So the first one is feeling dizzy, especially when you sit or stand up. If Tamsulosin makes you feel dizzy, as we've already discussed, stop what you're doing and sit or lie down until you feel better. It's important not to drive, ride a bike, or use tools or machinery if you're feeling dizzy. Also, don't drink alcohol, as it will make you feel worse. You should talk to your doctor if these side effects last more than a few days. Now, moving on to the second common side effect, some people also have problems ejaculating, such as little or no semen. Now, serious side effects affect less than 1 in 1,000 people, but you should call a doctor straight away if you get any of the following. So the first thing is shortness of breath or difficulty breathing. These can be signs of lung problems. You should also call your doctor straight away if you notice yellow skin or the whites of your eyes turning yellow. These can be signs of liver problems. Some people may get bruising or easy bleeding. This can be a sign of a blood problem, and you should go to accident and emergency if you get any chest pain, an irregular heartbeat, or you can feel your heartbeat. This is known as palpitations. These can be signs of heart problems. You should also go to A&E if you have problems speaking, weakness of the arms or legs, because these can be signs of a stroke. You should also attend the emergency department if you develop a painful erection that lasts 4 or more hours. Now, it's important to note that these are not all the side effects of Tamsulosin. For the full list, see the leaflet inside your medicine packet and adhere to the advice given on that medicine leaflet. So in terms of pregnancy and breastfeeding, well, Tamsulosin is not usually recommended in pregnancy. It's not clear whether Tamsulosin can harm your baby. And if you're taking Tamsulosin for kidney stones and you're pregnant or trying to get pregnant, talk to a doctor about the benefits and possible harms of taking Tamsulosin. Again, your doctor will be able to recommend the best treatment for you and your baby. So now let's talk about cautions with other medications. So there are some medicines that interfere with the way Tamsulosin works. You should tell a doctor or pharmacist if you're taking any other alpha blockers. So these are things such as doxazosin, prazosin, and terazosin. These may cause a decrease in your blood pressure. It may also be affected if you're taking other medicines for high blood pressure, because taking these with Tamsulosin can risk lowering the blood pressure too much, which again goes back to that symptom of feeling excessively dizzy or faint. Again, you should tell your doctor if this keeps happening. They may want to do some investigations, including things like a lying and standing blood pressure. You may also have problems if you're taking other medicines for erectile dysfunction, such as sildenafil. You also may have problems if you're taking medicines that may decrease the removal of Tamsulosin from the body. For example, ketoconazole, which is used for fungal infections, and antibiotics such as erythromycin and clarithromycin. So that brings us to the end of this video. I hope you found it useful, informative, and learned something new about this important class of medication. If you did, please remember to give the video a thumbs up, subscribe to the channel if you haven't done so already, and if you have any questions, please leave them in the comments section. However, do remember that this is a medical education channel and not a clinical advice channel. I therefore can't give any information about individual requests for medication advice. If you do have any concerns or specific questions about your medicine, you must speak to your own pharmacist or your doctor. Please also check out the description box of this video for a full disclaimer. Thanks for watching the video, and until next time, bye.